sexually transmitted diseases or sexually transmitted infections. We're going to cover these areas now. What are sexually transmitted diseases? STDs are infections that are transmitted from sexual contact, usually anal, oral or vaginal sex. They can also be spread from intimate sexual contact, for example if you and your partner's genitals are rubbing together or touching. STDs are usually caused by bacteria, viruses or parasites. Less commonly, STDs can be spread in other ways not involving sexual contact, such as sharing needles, childbirth or blood transfusions. It's essential to note that anyone can catch an STD regardless of your age or your sexual orientation. Many are curable, such as chlamydia and gonorrhea, but some are not curable, usually the ones spread from viruses like herpes, HIV, HPV, and usually we manage these as opposed to cure them. I understand that this is a worrying topic, so I'm going to go through what you need to know. STDs versus STIs. What is the difference? Well, both acronyms stand for conditions that are primarily spread through sexual activity. STI stands for sexually transmitted infection and STD stands for sexually transmitted disease. Usually we give the name STD when you have a disease, and disease are usually when you have advanced symptoms, while the term infection usually applies even if you don't have any symptoms. In day-to-day conversation, STD and STI, those terms are used interchangeably. The most common STDs and linked conditions are shown here in this list. Common STDs, their symptoms and their causes. So there are different types of STDs, each with its own list of symptoms. Your genital areas are warm and moist, which is ideal environments for bacteria, viruses and parasites to grow. Here you can see the STDs, which are most commonly caused by bacteria. And on this list, you can now see the common STDs caused by viruses. There are some common symptoms you get with STDs, but remember, in some cases, you might not get any symptoms, especially with infections like chlamydia. The most common symptoms of STDs usually include painful urination, pain during sex, fluid from your penis or vagina, often referred to as discharge, fever, abdominal pain, bleeding, itching, also getting sores, cuts or rashes in your genital area. Let's discuss some of the most common sexually transmitted infections. Chlamydia. Chlamydia is a bacterial infection that can cause genital, rectal and throat infections. Common symptoms of chlamydia include painful urination, discharge and pelvic pain. Gonorrhea. This is another bacterial infection that can cause infections in the genitals, the rectum and the throat. Common symptoms are similar to chlamydia, such as painful urination, discharge and pelvic pain. However, with chlamydia, often we find the discharge is yellowish, cloudy or clear. With gonorrhea, you might experience green or yellowish discharge. HPV. HPV is a viral infection which is incredibly common. Often it's asymptomatic, but it can go on to cause conditions like genital warts and increase your risk of certain types of cancer. Herpes. HSV1 and HSV2 are types of herpes viruses that cause viral infections that can lead to oral and genital herpes. Common symptoms you might experience are painful sores or blisters in your genitals or around your mouth. HIV. HIV is a viral infection that affects your immune system. This weakens your body's ability to fight infections. Common symptoms you might get with HIV include flu-like symptoms, usually a few weeks after infection, followed by a long period where you have no symptoms. Then, as your immune system gets affected, you might experience additional symptoms, including night sweats, diarrhea, unexplained weight loss, thrush, recurrent or persistent infections, fevers. Trichomonas. Trichomonas is a parasitic infection caused by a parasite. It can cause genital inflammation and discharge. Syphilis. Syphilis is a bacterial infection that progresses, if you leave it untreated, into different stages. It could lead to sores, rashes, potentially affect various organs, including your heart and brain, but early treatment is essential. How do you prevent STDs? Well, prevention is crucial for STDs, and there's some effective strategies you can use. Number one, safe sex. I'm sure you've heard using condoms is essential. Also, you could consider PrEP, pre-exposure prophylaxis for HIV prevention. If you're at risk of getting HIV, getting vaccinated, HPV vaccination can reduce your risk of getting genital warts and certain types of cancer. This is also a very important step. Regular testing. This is important for everyone, especially when you have new partners, and it's important to get your partner checked and tested as well. So when should you see a doctor, and how do you get a diagnosis? Well, if you suspect you have an STD or you've been exposed to one, it's crucial to get medical advice. It's worth remembering that doctors are here to support you, and we've seen many types of infection before. If you are tested and treated early, this often prevents long-term complications of STDs happening. To get a diagnosis, tests we might use are swabs, urine samples, and blood tests. Generally, we use swabs for conditions like chlamydia and gonorrhea, and urine samples for chlamydia and gonorrhea, and usually we need blood tests for syphilis and HIV. Getting regular screening is important, as there are STDs who don't often have symptoms, especially in the early stages, like chlamydia or HIV. Risk factors for STIs usually include younger age groups, having multiple partners, men who have sex with men, illicit drug use or alcohol abuse, having had a previous STI. Here are my top tips for when you see a doctor. Remember that if you've been exposed to an STD, it's important to give your doctor the time frame. This will help us decide whether you need a test straight away and whether you'll need another test later on. You may need a repeat test depending on the window period. The window period is the time between when you're exposed to an infection and when the STI can be accurately picked up on a test. Tests done too early may not always be accurate. Best time for the test will vary on the infection type you have. The window period can vary between a few days and 6 months, and it can often depend on the type of infection you have as well as the type of test that's being done. It's worth noting, however, that you can pass on the infection during the window period. The general timeframes for the window period are listed here. So what are the cures and treatments? While some STDs can be cured, usually with bacterial and parasitic causes, it's important to note that not all STDs can be cured. However, there's effective management you can still use even if it's not curable. So let's discuss some common STDs and treatments. Bacterial STDs. Bacterial infections are chlamydia, gonorrhea, syphilis, and they can generally be cured with appropriate antibiotic treatment. Parasitic STDs. Trichomonas, caused by a parasite, can often be cured and treated with antibiotics. Viral STDs. Several STDs are caused by viruses and there's currently no cure. However, there's effective management to help reduce outbreaks and severity of symptoms. Some examples of incurable STDs caused by viruses include HSV, the herpes simplex virus, as well as HIV, the human immunodeficiency virus. Another category is partially curable STDs. This includes HPV. HPV infections are common and most people clear the virus on their own without treatment. However, in certain high-risk groups or in certain strains of HPV, it could lead to cervical, anal, or other types of cancers. Vaccinations are incredibly important to help protect yourself, and as well as attending regular cervical screening. My top tip is it's crucial to finish the full course of antibiotic your doctor gives you. This is to make sure the infection is properly treated and cured, and then it's important to get your partner tested and treated. It's important not to have sex until you're both treated and the doctor has told you it's safe to do so you don't reinfect each other. Can you have an STD without having penetrative sex? Well, there's lots of sexual practices without penetration, such as fingering and oral sex. But it's a myth to think that you can only get STDs from penetration. This myth can result in people putting themselves at risk and not realizing. That's because these infections caused by bacteria and viruses can live on internal and external skin, as well as in bodily fluids. Sexually transmitted diseases without cures. There are some STDs that can't be cured, but there's lots of ways, as we mentioned earlier, of getting support for them. Treatments for these viruses can significantly reduce the chances of passing on the infection and help eliminate or manage symptoms. This includes for conditions such as HIV and herpes. STIs caused by bacteria, yeast, or parasites can usually be cured with appropriate medication. Sexually transmitted diseases caused by viruses. Please see this table. Sexually transmitted diseases caused by bacterial and parasitic causes. These can be seen here. Can sexually transmitted diseases cause erectile dysfunction? Well, it's not common, but it could be a complication of some STDs such as syphilis, chlamydia, and gonorrhea if these diseases are left untreated and glands such as your prostate gland and your epididymis become infected. In some cases, erectile dysfunction could be linked to psychological causes, often due to things like stress or anxiety, and it's more common with some STDs like HIV. So the summary is, it's important to remember that even if an STD is curable, regular testing and early detection helps prevent the spread of STDs and prevent the long-term complications from developing. It's also usually much easier to treat them early on, so get tested regularly, go for vaccination, attend screening programs, and keep yourself safe. And if you're not sure or you have symptoms, it's always best to speak to a doctor and we can help support you.